Hi, my name is Cara Thorne. My specialty is hand and upper extremity. So my background has been, I've been fairly nomadic the past few years. I started off at the University of Mississippi, where I ran track and field and did my pre-medical training. And then I went to the University of Pittsburgh for medical school and followed that with an orthopedic residency at the University of Virginia in Charlottesville, and just most recently finished my hand and upper extremity fellowship at the University of Colorado. So I initially went into orthopedics because, unlike other medical specialties, I really like that we can actually get people back or better to how they were before their injury. And hand and upper extremity in particular, it's just prevalent how much we use our hands. We use them to work, play, eat, hold the hand of the person that we love, and just so gratifying to help people through those types of injuries. My favorite thing about being a physician is getting to know people on a more intimate level. It's a window that you don't often get to see in your daily life, and just learning from people, learning about their background, their walk of life, and being able to help them get back to the things that they love. That's what I love most about being a physician. So what drew me to Colorado initially was the Hand and Upper Extremity Fellowship at the University of Colorado, and also my family and close friends that live here. And they were the gateway that allowed me to see all the awesome places and experiences that you can have in Colorado. So the things I enjoy doing primarily are being outside. So I love hiking, I love backpacking, camping, kayaking, and I've also branched out since coming to Colorado and gotten involved in fly fishing and more mountain biking. Mountain biking is a lot more intense here than in Virginia, so slow and steady start to that. Being active, I think, helps me relate to patients so that I can see both sides of the conversation. So I understand from both an emotional and physical level what it's like to have an injury, what it's like to not be able to do the things you love. And I think that helps me understand how to get people back to the activities they enjoy and love doing on a more personal level. Community outreach has always been very important to me. The most recent experience that I was involved with was the Touching Hands program in Honduras. I actually went with Dr. Peterson as well. And that experience was very gratifying in the sense that people there, they don't have the safety nets that some of us have in the US. And a small hand injury can mean the difference between feeding their family and not. And it was really gratifying to help them through these situations and get them back on their feet, so to speak, and get them back to being able to provide for their families. And so I know that OCR is heavily involved in the community, and I'm looking forward to being a participating member in that. The thing that excites me most about joining OCR is the incredible team atmosphere that we have and the collaborative environment that ensues from that. Another reason I wanted to go into hand surgery was just the vast array of patients that you get to treat. So we treat children to older adults, and we see everything that affects the upper extremities. So vascular injuries, nerve injuries, bone and joint injuries. And that's kind of rare for an orthopedic surgeon to be able to do that. And so I would treat things as simple as carpal tunnel to as complex as traumatic elbow injuries. And I love doing all of it. I'll be practicing at the Northern Colorado campuses, and I'll have appointments available and look forward to getting you back to the activities you love and enjoy.